Army Medical Center, the American Red Cross facilitated Human-Animal Bond Program has utilized the therapeutic healing power of animals to help patients recover from physical, social, and mental illness. It's also beneficial for staff to take a moment to switch gears.
And they're just as valuable here on the home front.
Where you bring a lot of smiles to the patients and the staff here, and even at the command group. Can I shake your hand? Huh? Oh, thank you. Thank you, Bella.
It's one of my favorite programs. I love animals, and I know how they benefit people. They can lift your spirit emotionally and even physically. Therapy dogs, they're non-judgmental, and they don't care if you're bandaged or scarred. They really just want to sincerely give you affection.
I can tell you, after a hard day's work and having been a dog owner, some of my best times and some of my most relaxing times are my encounters with my pets over the years.
You're depressed and thinking about what's going to happen next and what happened to them that made them cause them to be in the hospital. But animals, they're right there, they're here and now, and they can focus on that and not their problems or what's going to happen next, how scary the diagnosis or a surgery that might happen later on.
Medical studies suggest that human-animal bond program patients find multiple benefits, such as lower systolic blood pressure, increased endorphin production, and prolactin and dopamine levels, and shorter hospital stays when they have access to pets. A visit from a pet can bring a sense of well-being and happiness to patients through the age-old bond of human-animal interaction. While all patients benefit, it is especially important to those who are confined to their beds. The psychological of healing can provide decreased anxiety and a sense of alleviation, comfort, and contentment.
Being stationed at Fort Shafter, I'm the Tripler Human-Animal Bond Veterinary Liaison. The basic process is first we make sure that they have all their vaccines, all their health check tests, all the requirements. And if it's a dog, to make sure that they already have their canine good citizenship test, make sure they have that first. And then I do a temperament test on them. For the temperament test, mostly what I'm trying to decide is that it's comfortable around people and that it's not going to be a danger to any of the people at the hospital. I just watch the animal to make sure that, it's happy, friendly. A place that it's never been to before. If I have any worries about that, then I go and make it meet a bunch of other people so I can watch it meeting other people too. Make sure that they're okay being in a submissive position with somebody that they don't know very well, me. What I do is I roll them over on their back. Whether if it's a big dog, I'll usually just roll them over on their side, rub their belly. If it's a small dog, I'll sort of carry him like a little baby. I check to make sure that in strange situations, things that it's not comfortable with, a danger to itself or anyone around it. So usually animal's reaction to that. A good reaction. She wasn't afraid of it. She didn't go cower in the corner. You never know what is going to be happening at Tripler, and you don't want animals being unpredictable, running away, hiding under things, getting caught underfoot in a hallway at a big hospital.
The Care Provider Support Program likes to offer opportunities for doctors, nurses, social workers, medics, psychologists, psychiatrists to have an opportunity to interact with animals through the Human-Animal Bond Program. The idea, for example, many dog owners have said that we definitely see that in action, where dogs seem to have an ability to be quick to genuine forgiveness and an openness to closeness. And we also see that actually in cats too.
got me involved in this program. I thought dogs must have some kind of therapeutic value. And just holding them, the warmth, the comfort, the security made me feel a lot better. I thought maybe if he could help me, he could help others too. So it's kind of a win-win for everybody. So I love this program, and Daniel just loves the people up there at
People are willing to also, the touch of an animal's fur and feeling the warmth of its body, and can really fall into the present moment in a different kind of way than they typically allow themselves to do. So someone could be busy in a moment and thinking of all the paperwork they need to do, and along comes the dog, and they bend over and smile and pet the dog, and in a few minutes they can just be kind of caressing the animal and really treasuring that particular moment. And that's an important thing that we often postpone far too much. So one of the keys to resiliency is being able to be open to the present moment, and probably some of our best teachers about the present moment are our four-footed friends.
You know, animals give unconditional love. Everyone knows that. And you can be in the hospital depressed, you can have scars or bandages all over your face or missing a limb, and the animal doesn't notice and doesn't care. And so that is the magic of unconditional love, that the animal just wants to make you feel better, and it's just accepting you as who you are and not what you look like.
The human-animal bond dates back a very long history of it. You see the petroglyphs, the hieroglyphs, and they all involve animals. There's something about human-animal interaction that it's just good for the soul. When you see a dog walk into the hospital, into a patient's bedroom, the patient's been bedridden for a long time, not talking to anybody, you just see their whole face light up, and it's just a big warm fuzzy.
Thank our handling team for what they do day in and day out, and I want to encourage you to be aware of this program, and if you get the opportunity to bond with some of our animals and take that opportunity to smile.
I want to thank you for your service, Indy. Thanks for everything you do for us here.
U.S. Army. Salute.
And a salute.
U.S. Army.
All
U.S.
right,
Army. U.S. Army.
Indy.
Give a good salute. U.S. Army.
All
Good boy. U.S. Army. Good boy.
Sometimes the best medicine is a laugh, a smile, a hug, or a four-legged kiss. The Tripler Army Medical Center's all-volunteer human-animal bond program lowers stress, promotes healing, and raises morale. Animals share pure love, and there's nothing more healing than a dose of love.